Welcome to my channel, Science Daily Dose. Alien hand syndrome (ARS) is a rare neurological disorder in which a person experiences their hands acting seemingly on their own, without conscious control over the actions. The affected hand may perform complex, goal-directed movements, such as buttoning a shirt or undressing, or it may make simple, repetitive movements, such as rubbing the thumb and forefinger together. In some cases, the affected hand may even try to harm the person, such as by picking at their face or hair. ARS is most commonly caused by damage to the corpus callosum, a thick band of nerve fibers that connects the two hemispheres of the brain. This damage can be caused by a stroke, brain tumor, head injury, or surgery. In some cases, ARS can also be caused by neurodegenerative diseases, such as Parkinson's disease or progressive supranuclear palsy. The symptoms of ARS can vary from person to person. Some people with ARS may experience only mild symptoms, while others may have more severe symptoms that interfere with their daily activities. There is no cure for ARS, but there are treatments that can help to reduce the symptoms. These treatments may include medication, physical therapy, or occupational therapy. Here are some of the common symptoms of alien hand syndrome. 1. The affected hand may move involuntarily. 2. The affected hand may perform complex, goal-directed movements. 3. The affected hand may make simple, repetitive movements. 4. The affected hand may try to harm the person. 5. The person may feel a sense of detachment from the affected hand. 6. The person may feel like the affected hand is not their own. If you experience any of these symptoms, it is important to see a doctor to get a diagnosis. In some cases, the symptoms of ARS may improve over time. However, in other cases, the symptoms may be permanent. Thanks for watching. Follow us at Science Daily Dose.